All right, today's lesson will cover 9.4, which is stop disease in its tracks, as well as 10.1, which is how diseases affect society. All right, so we'll talk about food poisoning and prevention of food poisoning. So there's a bacteria called Staphylococcus, or it's the staph bacteria, and it causes food poisoning. So this staph bacteria that causes food poisoning, it enters food from when people cough, sneeze, or handle food without washing their hands properly. So using rubber gloves will prevent some of the spread of that bacteria. Careful cleaning of the cooking utensils and area will also help. Dishcloths, making sure that dishcloths are changed daily because bacteria can grow in those used dishcloths. And then not using sponges because they provide great breeding grounds for bacteria. But also food poisoning can also be caused by food that's not preserved well. So it's not refrigerated well or stored properly. Botulism, it's a form of food poisoning. There's a bacteria that causes botulism, and it has the ability to grow in the absence of air, and it produces the deadliest toxin known. The death rate is high if it's not treated immediately. And common source, for example, is like sausages. Botulism comes from the Latin word botulus, which means sausage. It's also known as Kerner's disease. It was named after the man who was signing the death certificates of people who ate contaminated sausage and then died. And there was an outbreak in Germany. That's where Kerner was from. So methods of food preservation. Preserving food prevents or limits the growth of pathogens that cause food poisoning. So smoking or drying the food is removing moisture so that the pathogens can't grow. Canning, the jars get filled with food and then are boiled in hot water to kill those existing pathogens. Salting also removes moisture, just like smoking or drying. So it removes moisture from the cells and it makes a pH which is inhospitable for the bacteria to grow in. Refrigerating, so bacteria, they need warm temperatures to live and reproduce. So refrigerating in a cooler environment, it slows down the growth of pathogens. Freezing causes bacteria to enter a dormant stage, and then it'll prevent the growth of pathogens. Adding chemical additives like sugar and salt slows the growth of bacteria. Vacuum packaging. So most bacteria need air in order to survive. So vacuum packaging removes the air from the package, and then therefore a reduction in the number of bacteria that can spoil food. But unfortunately, some bacteria, like botulism bacteria, they thrive in low oxygen environments, so they can reproduce in foods packaged this way and can still cause food poisoning. Irradiation is exposing food to certain types of radiation, like UV radiation, and it destroys pathogens in, for example, meat, fish, and poultry. Pasteurization is when heating a liquid to a high enough temperature to kill the bacteria. All right, because bacteria can't survive in extremely high temperatures. So you heat up the liquid, for example, like milk, to a high enough temperature for a specific period of time. Then the liquid gets cooled rapidly and refrigerated. Okay, and this method, it'll destroy those harmful bacteria, but it doesn't change the flavor or the nutritional value of the food. Keeping hospitals healthy. So 200 years ago, people, if they went to hospitals, they were expected to die because hospitals were so unsanitary that patients would pick up diseases from the hospital. Today, it's much less common because of the work of these scientists. Florence Nightingale Joseph Lister, and Robert Koch. So Florence Nightingale, she worked in a military hospital in Turkey in the 1800s, and she was able to reduce the death rate by making sure that the hospital and the patients were kept clean, improving the water quality, and bandaging wounds to prevent infections from spreading to other patients. And Lister, Joseph Lister, he was also, during the 1800s, he was an English surgeon, and he found that many patients were dying from infections after surgery. So he started spraying carbolic acid on patient wounds and into the air of operating theaters. And what this carbolic acid did is it killed pathogens on the surfaces and on the skin. Then Robert Koch, he discovered that hot steam was effective in killing pathogens. So he began using steam to destroy living organisms. All right, so sterilization is what he found. It's the process that uses steam to destroy bacteria. All right, and then we get into aseptic methods. So when we talk about aseptic, it means it's free of pathogens. So modern medicine uses many techniques to keep hospital rooms and equipment aseptic. So for example, using sterile bandages, instruments, linens, masks, and clothing during surgery, scrubbing all the exposed skin of the surgeon before and after surgery, and then making sure that all the staff, the surgical staff, are wearing rubber gloves, again, to prevent the spread of pathogens that may be, for example, under their fingernails. Antiseptics are used on people to disinfect the skin. So for example, iodine solution and alcohol are found in antiseptics. And then disinfectants are used on objects and surfaces to sterilize them. Again, common disinfectants include iodine, chlorine, bleach, and antibacterial soaps. Triclosan is a disinfectant that's commonly used in soaps and shampoos, body washes, and toothpastes. Just a fact here from the Did You Know that hospitals in the Middle East, they were among the first to recognize the importance of sanitation. By the 1100s, so much earlier, hospitals in Baghdad and Cairo contained fountains where patients could wash themselves, and washing facilities for patients in Europe appeared much later. And in fact, in Europe, many surgeons were performing operations without even washing their hands. All right, there's a short video here on which is better, soap or hand sanitizer. And then there's the Chapter 9.4 questions and Chapter 9 review questions. All right, so Chapter 10 gets into society's response to disease, and 10.1 is how diseases affect society. So we're going to talk about Aboriginal groups. So European explorers, they brought many things to the New World, such as horses, iron pots, rifles, and even new seeds. But what affected Aboriginal groups the most were the diseases they brought, including smallpox, tuberculosis, and flu. So Aboriginal groups, they were not able to fight the diseases because they had never been exposed to certain illnesses, and therefore millions of them died. The effect of so many deaths was tragic. So with fewer hunters, more people starved, many young women died, so the birth rate in Aboriginal communities slowed. Many elders died before passing on their knowledge of important traditions. So the knowledge of some customs were also lost. So when we talk about a pandemic disease, so despite modern knowledge of sanitation and personal hygiene, we are not able to prevent the spread of communicable diseases like AIDS, for example, because people continue to do things that increase their risk of getting such diseases. So when we talk about a pandemic, these are diseases that are extremely difficult to control. So for example, AIDS, and they affect a large proportion of the population over a large geographic area. So that's classified as a pandemic. All right, so again, pandemic are diseases that affect a large proportion of the people over a large geographic area, and they're difficult to control. So they're farther reaching than epidemics. So epidemics are diseases that spread through the population faster and more widely than would normally be expected, but they are not as widespread as pandemics. All right, so contagious diseases that are not so widespread, they are called epidemics. All right, so for example, when many people in a local area suffer from a disease at the same time, that would be an epidemic. But if it's affecting a large proportion of the population in many, many countries, then it's a pandemic. All right, there is a short video here on a pandemic and when is a pandemic over. All right, and here's just a brief timeline of some pandemics. So this is the first one, 1346 to 1350, the bubonic plague pandemic. So this was a dangerous bacterial disease. Symptoms included fever, chills, swollen glands. And from 1346 to 1350, it spread through Asia and Europe. After the 1300s, it wasn't as widespread for several centuries, but there were two more pandemics, once in 1542 and the other in 1900. And the last reported case was in San Francisco during World War I. So the social conditions during this bubonic plague pandemic, there was overcrowded cities, there was a limited amount of clean water, there wasn't waste disposal facilities, poor sanitation and hygiene, and there was a high population of rats that carried the disease. The impact of this disease, 30 to 50% of the population died, over 100 million deaths worldwide, and people with the plague were put into quarantine, which means they were held in sealed off areas until they either died or they got better and no longer posed a threat to others. And only authorities with special permission were allowed to enter that quarantine area. Another impact of this disease was the crime rate dropped. This diagram is just showing how people with the plague, like doctors that were treating people with the plague, how they were dressed to try to avoid getting the disease. And so they would wear this mask, a beak-shaped mask, and inside that beak, there were like spices inside of there they were intended to purify the air. And the wand here was used to take each patient's pulse. All right, so during this time, doctors didn't know that it was bacteria that was spreading the plague. 1500s to 1700s, there was the tuberculosis epidemic. So it is a bacterial disease. It damages the lungs. It was common in Europe, and then it was spread around the world by the European sailors and explorers. In Canada, it's responsible for a lot of illnesses and many deaths among Aboriginal peoples. Social conditions were that Aboriginal population did not have previous exposure to the disease. Other conditions, for example, overcrowding in boarding schools, poor air circulation, lack of sanitation, and poor diets. The impact, patients were sent to special treatment facilities called sanatoriums. Many children were put up for adoption instead of being returned to their families. And then some Aboriginal adults lost contact with their communities. In Western Canada, in the early 1900s, 25% of Aboriginal and Inuit children in residential schools died of tuberculosis. They are 7 times more likely to get that tuberculosis. 1918, there was a Spanish flu pandemic. This is a viral disease. It spread around the world during 1918, and it killed thousands of people on every continent except Antarctica. So social conditions, soldiers traveling during World War I, they spread the flu to people who hadn't previously been exposed. There's poor sanitation, poor diets, little or no access to medical care because the healthcare professionals were working with sick and injured soldiers. The impact in Canada, more people died from the Spanish flu than from the war. 21 million deaths worldwide. A loss of income for businesses such as theaters and restaurants because of people's fear of catching the flu. And again, the crime rate also dropped. In Alberta, Spanish flu arrived in October of 1918 with 15 ill soldiers who were returning from World War I. The soldiers were isolated at a military camp, but the disease still spread. So the numbers of infected people grew so high that the government had to ban public gatherings. More than 3,000 Albertans died. And if you were in New York in 1918, there was a fine you had to pay of $500 if you were spitting, sneezing, or coughing in public. And these laws were, again, trying to reduce the spread of that Spanish flu. And 1980s to present, the AIDS pandemic, it's a viral disease, weakens the ability of the body to fight diseases. It was officially recognized as a disease in 1980. It's common around the world, and it's increasing in severity. In Canada, there's about 10% increase in new infections each year. Social conditions, sexual contact, sharing needles, for example, for drugs or tattoos, infants that are born from infected mothers, or transfusions of infected blood. The impact, it's the fourth leading cause of death worldwide. There's high costs for treatment, there's no cure, and there's a lot of fear and confusion about AIDS, which results in negative treatment of infected individuals. Here's just some more facts. In some countries of Africa, like Uganda, up to 1/3 of the people of childbearing age are infected with HIV. And because of that, many children are poorly cared for or are orphaned at a young age. Many people aren't able to work, so the economy has been adversely affected, and the cost of treating AIDS is very high, so high that governments can't afford to treat the victims. Okay, so the beginning of public health, it started with the plague. So at first, nothing was done to kill the rats that originally spread the disease. As well, people were just dumping human waste into the streets. So people began to understand that there's a connection between sanitation and disease. So city officials started to order streets to be cleaned and quarantine the sick people in special facilities. Okay, and then that brought on public health. For example, it's where the government gets involved in caring for the public health. So government and other agencies, they start working together to develop and maintain healthy communities. In England, there was the Year of the Great Stink, which helped speed the development of these laws. So it was like 1858, which was the Year of the Great Stink. So what was happening was, for centuries, people were dumping human waste in the water and into the Thames River in London, and it was so full of sewage that the city stank, and the smell was so strong that people in the House of Parliament couldn't do their work. So laws started to get passed to make sure that the Thames River never got so bad again. Okay, people that were dumping waste or sewage in the Thames River started to get fined, and they may not have been laws that were very well enforced, but it was the beginning of the public health system that we have today. All right, this here figure is just showing that sanitary public toilets, they're not available everywhere around the world. Some countries use a cesspit like this, just an open hole. And when that cesspit becomes full, urine and feces are just going to come out of that hole and then can run into the street and again spread diseases and sickness from the pathogens that are present. There's a short video here, a brief history of toilets. It kind of goes over the different sanitary public toilets around the world and the invention of the toilet we use today. And then these are the questions for 10.1.